In recent years, a troubling trend has captured the attention of health professionals and activists alike: the disproportionately high mortality rate among Black women in the United States. This issue goes beyond mere statistics. It reflects deep-seated inequities in our healthcare system and societal structures. Today, we delve into why Black women's mortality rates are significantly higher than those of other racial groups and what can be done to address this urgent public health crisis. The statistics are startling. Studies indicate that Black women are more likely to die from a variety of health-related causes than women of any other race. Heart disease, stroke, and breast cancer claim the lives of Black women at higher rates, but perhaps most alarming is the disparity observed in maternal mortality. Pregnant Black women are 3 to 4 times more likely to die from pregnancy-related complications than their white counterparts. This isn't just a personal tragedy, it's a stark reminder of systemic failings that demand our attention. But what lies at the root of these disparities? Several critical factors contribute to this ongoing crisis. One of the most significant is inequitable access to healthcare. Black women often face barriers to obtaining quality medical care, barriers that can be economic, geographic, or cultural in nature. Many live in communities where hospitals and clinics are underfunded and preventive care services are scarce. When access is available, they may encounter implicit biases from healthcare providers, leading to misdiagnosis or inadequate treatment. Furthermore, socioeconomic status plays a pivotal role in health outcomes. Black women are disproportionately represented in lower income brackets, facing economic hardships that can directly impact their health. The stress associated with financial instability, coupled with potentially unsafe living conditions, can exacerbate health issues or make it difficult to prioritize healthcare needs. This cycle of poverty and poor health outcomes can be relentless, further widening the mortality gap. Cultural and social determinants cannot be overlooked either. Stress from discrimination and racial bias profoundly impacts health. African American women often navigate daily life at the intersection of race and gender-based stresses, which can lead to conditions like hypertension, often referred to as the silent killer, among Black communities. The weight of these societal pressures is not merely psychological, they manifest physically, worsening health outcomes over time. As sobering as these insights are, they underscore the critical need for systemic changes. To begin addressing disparities in Black women's health, it is imperative to ensure equitable access to quality healthcare services. This requires policy reform that targets funding and resources to underserved communities, ensuring that healthcare infrastructure is both physically and culturally accessible. There must also be a concerted effort to train healthcare professionals to recognize and address their own biases, enabling them to provide care that is not only clinically competent but also culturally sensitive. Beyond healthcare, broader social interventions are essential. Addressing the economic disparities that affect Black women requires initiatives that support education and job opportunities, empowering them to break the cycle of poverty. Additionally, public awareness campaigns can play a vital role in changing perceptions and reducing stigma, fostering environments that support both mental and physical health. In conclusion, the higher mortality rate among Black women is a pressing public health concern, deeply rooted in systemic inequities. It's a multifaceted issue that requires a comprehensive approach involving healthcare reform, social policy changes, and community engagement. By acknowledging these disparities and taking action to address the underlying causes, we can work toward a future where health equity is not just an aspiration, but a reality. Let us hope that this discussion sparks awareness and inspires the changes needed to ensure a healthier and more just society for all.